Well, good morning, all. I'm Tammy Dillard-Stills, Chief Executive Officer of SOFI. Thank you all for joining us today and welcome to this webinar, Inclusive LGBTQ Health Education, a model for countering misinformation. On behalf of SOFI, we are pleased with the interest in today's webinar and are thankful that you have taken the time out of your day to participate. The Society for Public Health Education is an inclusive organization of health professionals. We welcome your whole self. Today's webinar will be moderated by Bashar Jenkins Jr., the Manager of Policy and Programs with SOFI. Bashar Jenkins Jr., MPP, is an emerging health equity practitioner based in Washington, D.C. As the Manager of Programs at SOFI, he leads the federal advocacy efforts. Prior to SOFI, Bashar served as Congressional Black Caucus Foundation Fellow. Bashar proudly hails from Trenton, New Jersey. SOFI's mission is supporting leaders in health education and promotion to advance health equity in communities across the globe. Members include the health education professionals and students throughout the United States and internationally. The organization promotes healthy behaviors, healthy communities, and healthy environments throughout its membership. Its network of local chapters and numerous partnerships, with other organizations range throughout the US and internationally. Now, I am excited to introduce today's speakers, Megan L. Smith, Preston D. Mitchum, Alex Kuroglian, and Mason J. Dunn. A little bit about each one. Dr. Megan L. Smith is an associate professor of the Department of Public Health and Population Science at Boise State University. Dr. Smith received her PhD in Human Development and Family Studies from West Virginia in 2015. Dr. Smith's works build on education, human development, and public health science to study the contextual factors that promote or thwart health outcomes for young people. Next, we have Preston Mitchum. He is the Director of Advocacy and Government Affairs with the Trevor Project. He is a Black queer attorney, advocate, and activist with a focus on the power of Black people, young people, and queer, trans, and non-binary people. Preston deeply believes in community organizing and training younger generations. Preston has been featured in Washington Post, BET, MTV, The Root, The Griot, The Atlantic, BuzzFeed, CNN, Fox News, MSNBC, The Guardian, and a plethora of other medias. Preston resides in Washington, D.C., where he actively pushes for safe spaces for Black LGBTQ residents. Next, I'll introduce Alex Kuroglian, MD, MPH. He's an associate professor of psychiatry at Harvard Medical School and director of the Division of Education and Training at the Fenway Institute. He directs the National LGBTQIA+ Health Education Center at the Fenway Institute, an HRSA BHC-funded cooperative agreement to improve the care of LGBTQIA+ people across the US. He also co-directs the HMS Sexual and Gender Minority Health Equity Initiative, which leads longitudinal medical curriculums and faculty development in sexual and gender minority health. And finally, we have Mason J. Dunn, JD, is the Deputy Director of Education and Training Programs at the Fenway Institute. Mason is a lawyer and brings their legal and advocacy experience to the Institute. They have worked in the LGBTQ plus equality movement for over 15 years across the country. In 2018, Mason co-chaired the historic Yes on 3 campaign, which successfully defended the Massachusetts trans-inclusive public accommodation non-discrimination law and the nation's first ever wide vote on transgender rights. I welcome our speakers and I'll pass it over to Bashar. Thank you.
Good morning, everyone. Thank you, Tammy, for that lovely introduction of our wonderful panelists today. Just to sort of get us started, each of you in your respective capacities, either as an advocate, a practitioner, a scholar, a researcher, and some of you with even lived experience can sort of speak to this current state that the country is in regarding inclusive LGBTQ health education. So what do you see as the current state of LGBTQ health education right now? And what role do you see misinformation playing in shaping the future of health education and its impact on LGBTQ people? Also with the mindset of the current political landscape as well. So I'll open it up to whoever wants to jump right in.
I'm happy to get us started. So hello, everyone. So unfortunately, the current state of health education in the United States leaves a lot to be desired when it comes to LGBTQ education and inclusion. And frankly, I think that's putting it lightly. Due right now to the current patchwork of laws and the approach that many of us have to health education and educators, their guidelines and requirements, the type of education that students receive can vary dramatically depending on where they live and really what school they attend within where they live. And so currently, as we know, according to state policies, there are about 10 or so, plus Washington, D.C., that have policies that require sex education to be LGBTQ inclusive. And to address this issue, there are certain things that we can do for sure. We just haven't done them yet. Because to your point around what's actually happening in the political climate and realities that many LGBTQ youth are facing. We do have bills in Congress, for example, the Real Education and Access for Healthy Youth Act, which is a federal bill that would create federal funding stream for comprehensive sex ed, which is fully LGBT inclusive. I do want to just say here, right, like it is quite fitting, of course, that we're discussing sexuality in sex education and thinking through like what efforts to oppose LGBT inclusion means in health education. Because when you actually think about things like Florida's Don't Say Gay or Trans bills that was recently signed into law by Governor DeSantis, we're thinking about bills and how they actually impact classroom instruction on sexual orientation and gender identity, but also erasing LGBTQ history and culture. And I think that those things must be read as together, not separate issues, because we don't live single issue lives, as Audre Lorde would say. So even with those provisions that are deeply embedded in the school curriculum, right, they include things like vague parental notification and consent requirements for what even can be taught and what students want to receive information to. And in some of those bills, it actually requires teachers to out students to their legal guardians or parents without their consent, regardless of even if the teachers want to be supportive of them. And so, these multiple bad bills that we're seeing coming through the pike exacerbates this patchwork of guidance or guidelines that we're seeing throughout the state. And frankly, it's because of the political reality that we're situated in and the anti-LGBTQ lawmakers that make that political reality even more pronounced.
I'll just chime in around the misinformation, and particularly the misinformation that is driving a lot of these anti-transgender youth healthcare bills. There is this, I think, a terrible misunderstanding of who transgender youth are, their resilience, their power, their desire to be kids first, and misunderstanding who they are, as well as a fundamental misunderstanding about what gender affirming care for transgender youth looks like and what it means. And so unfortunately, I think those pieces of misinformation about just the fundamentals of providing care for transgender youth is fueling a backlash of anti-trans legislation in, we have states like Florida and Arizona where this is moving, and many, many other states where these healthcare bans are unfortunately gaining steam.
Yeah, I agree with everything that's been said so far, and we're very much in the infancy of having a systematic and universal approach to LGBTQI plus health education. I think about this in three components. There's what, for lack of a better term, in medical training, we would refer to as undergraduate medical education, but broadly thinking about all health professionals, this is the training that people get in their formative clinical years, right? So medical school, nursing school, social work school, training as a psychologist, for example. And it's not at all part of the standard curriculum for people to emerge confident and competent, providing excellent culturally responsive care for LGBTQI plus people. There was a famous study that was done over a decade ago that's being redone now that found that on average medical schools in the US and Canada, for example, had in total across all 4 years, 5 hours of training in what was referred to as LGBT health at the time. And there's good work happening to improve that formative training that people get. We have, as was mentioned in the introduction, at our medical school, a sexual and gender minority health equity initiative to integrate LGBTQI plus health into the core curriculum across preclinical courses, principal clinical experiences on the wards, like clinical rotations, and then advanced courses. I started and direct an elective and a selective for senior Harvard medical students in this area as examples. One is on caring for patients with diverse sexual orientations, gender identities, and sex development. That's a clinical and scholarly elective. And there's a selective this month that we have 25 Harvard medical students in every day, all month. That's on sex and gender informed medicine. And that includes research methods, clinical work, policy, health systems, transformation. And we're doing more to embed it into the existing courses. So someone teaching endocrinology or immunology, for example, can think about the ways in which that's relevant, both in terms of the content and the process for how they teach, thinking about dynamics in the room, the fact that we now, for example, 20% of our incoming med school class identifies as LGBTQI+, which is exciting. And we're seeing similar efforts at schools across the country. So that's at what we would call the undergraduate clinical training level. Then there's graduate training like residency, fellowship, and part of what we're doing there is just developing what the competencies are that we want people to meet so that program directors have that list and are thinking about how those competencies are being imparted and met during training. And then there's what we call continuing education, which is what Mason and I spend much of our time doing through our National LGBTQI+ Health Education Center. The Fenway Institute, for example, we're funded by the Bureau of Primary Healthcare to provide education, training, technical assistance, and implementation for care teams that are already fully formed clinicians out in the workforce. They're not in school anymore. They're not in formal training per se, but they suddenly have transgender and gender diverse patients in front of them that they were never taught how to take care of and need resources, want additional training. So we have national webinars we do, national conferences. We develop best practice guidelines for the Bureau of Primary Healthcare and the federal government that are disseminated nationally. And people get continuing education credits for this. And there's a huge, for lack of a better term, not to use capitalistic language, but huge market for this in terms of people really realizing that they were never taught to do this, right? So none of those things are levels are particularly well developed right now. And that means we have a huge opportunity as health educators to develop frameworks and curricula and to scale up nationally. And that's part of what we're really excited about.
Yeah, thank you. And I think when we're building on that sort of opportunity, as you call it, I think one of the things we need to recognize is that kind of like what Preston said, at the K-12 level, it's, there are only really, between 7 and 10 states that even mandate inclusive sexual education of LGBTQ issues. And then addition to that, we are in a moment in society where lots of things are becoming noise and empowering groups of people who normally wouldn't react as angrily or as fearfully to these things, but LGBTQ rights, for whatever reason, there's some opportunists who have lumped that into the mob, similar to our, pushback on CRT. There's just some interesting things going on in society right now. And I think that's where we need to work on the misinformation, for instance. The work I do is in schools around mental health with youth. And I can tell you in our context right now, there is huge pushback even to identify young people privately on a survey. I live in a state where they opt out of that question on the YRBS, which is a National Youth Behavior Survey. And so I think we're seeing a small minority of those voices sort of take over this. And so I think one of the things we need to do, being on that frontier, as you mentioned, Alex, is make sure that we're also including those folks in the anti-misinformation campaigns that we create, and figuring out how to communicate to those audiences who are going to make what we have been working towards, at least at the K-12 level in inclusive sexual comprehensive ed, they're going to make it stall out. So we need to figure out how do we work with those people and combat the misinformation. And I don't want to get into too many examples right now, but the stories and the fears I hear are certainly founded in misinformation around what it is to be a trans youth, what it is to be a gay or lesbian youth. And I think those are the things that we need to think about. How do we talk to that community and provide information that they can hear? But I'm sure we'll get into that later.
So with all of that in mind, I also want us to consider the youth mental health crisis that's ongoing in the country. Every day we're seeing more and more articles, stories, studies that are talking about the impact that COVID has had on LGBTQ youth, but we also know that this crisis was already thriving before COVID even arrived. So could each of you, or, in conversation with one another, would you be able to speak to the impact that this political moment is having tangibly on the mental health of LGBTQ youth?
I'll just jump in. I hate to go first, but this is my area. I love mental health. So yeah, I mean, obviously, two of the antidotes, if you will, to suicide completion or ideation are connection and belonging. And when we sever people out of our spaces, we are actually severing their ability to find connection and belonging, and that increases suicidal risk, suicidal ideation, depression, etc. And so one of the things we need to, I think, communicate to folks is around finding ways to connect these individuals into spaces that are safe, spaces that feel like they belong, and that can go a long way towards mental health. As you said, the pandemic definitely sort of exacerbated the disconnection feeling. And right now we're seeing suicide rates, suicidal ideation go up, suicidal completion go up, and also depression and disconnection, right? Loneliness. And when you are feeling that in your community, and then it's amplified on a national stage where you're seeing state and national level bills take away from who you are, I think it can obviously create huge problems. And I would also say that that is compounded by the racism that we're seeing at the national and state levels as far as laws. If you can imagine having an identity of that intersection of being a person of color and also a person who identifies as LGBTQ, and watching what feels like a society attack your identity and your rights, it can be extremely detrimental, especially to young people who are developing through these stages.
Yeah, I'm happy to jump in here as well. The Trevor Project is the world's largest mental health and suicide prevention organization for LGBTQ youth. And I think it's important to ground it in that reality because, every month we come out with tons of research and data speaking to the exact points that Megan just mentioned. And what we do know right now is that 85% of trans and non-binary youth say that recent debates just around anti-trans bills alone have negatively impacted their mental health. And you have to think what that means, right? You know, it is about increasing of suicidal ideations or even suicide attempts. It means increases for increasing rates of anxiety and depression and really the disconnect that Megan is speaking about. And I think it's always important to ground in that reality because we know that LGBTQ youth should just be able to see themselves reflected in schools, right? In lessons that they learn, in the communities that they're in. And so that means that content that we're discussing, like amid everything that's going on, should still be LGBT inclusive and creating these safe and affirming learning environments to be supportive and affirming of all students. We recently came out with data, and that data show that specifically with just one affirming adult to reduce the chances of suicide by 35 to 40%. That is groundbreaking, right? When you're thinking about the fact that just one person, just one adult, could be an administrator, it could be someone who's just working in a classroom, it could literally be someone's parents, right? Not even your own, right? But just one adult, one supportive adult can actually shift what someone's ideations may be. And so, you know, also according to our research, 42% of LGBTQ youth seriously considered attempting suicide in the past year alone, including more than half of trans and non-binary youth. However, there is a however there, right? LGBT youth who had access to spaces that affirmed their sexual orientation and gender identity and expression, included in schools, reported lower rates of attempting suicide than those who did not, right? So tons of the data points that we're speaking to, all this is around what positive content looks like, around LGBTQ people and issues and classroom curricula. And I find that important to emphasize, especially around LGBTQ youth who are consistently found to be at increased risk of bullying and sexual assault and physical dating violence. And we know that comprehensive sex ed, right to the point of what an LGBT inclusive policies can look like, should cover those things, right, in all 50 states throughout the entire country, and even in all the cities in the 50 states in the entire country, right? Like that is how we get to the long-term impact of making sure that we're reducing harm for LGBTQ youth.
Yeah, and just on the policy, we need to be thoughtful about how we are looking at it. Again, one of the things Sophie has recently called for, as Bashar knows, is expanding policies around asking about LGBTQ status of youth. Like I mentioned, in my state, we don't ask about it. And we're not the only state. And so I think one of the things is that it's easy to say this community is invisible or to misrepresent them with misinformation because we don't have the information, right? So folks in my state can say we don't have that problem because they're not measuring for these types of identities. And I think that is a crucial part of, if we're thinking of long-term policy, like how do we actually change the landscape for folks? We start collecting and making those folks visible in our communities.
I agree with everything that's been said. I practice clinically as a psychiatrist at Fenway, so working primarily with LGBTQI plus patients at our federally qualified health center, and everything that we've heard so far today and that we see in the research is something that we observe and respond to clinically in our practice as well. We've done a lot of the kind of foundational research also just showing the mental health benefits of a gender-affirming approach. So we published a study in 2020 in JAMA Psychiatry with the US Transgender Survey showing that gender identity conversion efforts are associated with more than twice the odds of attempting suicide in one's lifetime. And if you're exposed to those conversion efforts before age 10, that's associated with more than 4 times the odds of attempting suicide in your lifetime. And that study was then cited by the American Medical Association when they passed a resolution in support of a federal ban on conversion efforts, which hasn't happened yet, obviously, and by the United Nations General Assembly, when they fortunately also passed a resolution in support of an international ban on conversion efforts, which hasn't happened, but both organizations are laying the political groundwork for that. We've published some other studies out of the US Trans Survey showing that social gender affirmation for youth is associated with good mental health outcomes. So if you're socially affirmed before age 10 or as a teenager, your mental health outcomes in adulthood are just as good as if someone isn't socially affirmed till adulthood. So this whole watchful waiting notion doesn't make sense and isn't helpful. In pediatrics, we published a study 2 years ago, again out of the US Trans Survey. So all these data are from all 50 US states, showing that access to pubertal suppression gonadotropin-releasing hormone analogs in Tanner stage 2 of puberty to press pause on puberty for trans and gender diverse youth is associated with decreased lifetime suicidal ideation compared to desiring and not accessing pubertal suppression. And a year ago in JAMA Surgery, we published a study showing that access to gender-affirming surgeries is associated with improved mental health, including decreased odds of suicidal ideation compared to desiring and not accessing gender-affirming surgeries. And the medical student actually I did the study with did this clever analysis looking at the degree of surgical gender affirmation. So people who accessed all their desired gender-affirming surgeries versus just some of their desired gender-affirming surgeries had decreased odds of lifetime suicide attempts, past year suicide attempts, past year suicidal ideation, past year cigarette smoking, binge alcohol use, and serious psychological distress. And most recently, in January, we did a study we published in PLOS ONE showing that earlier access to gender-affirming hormones based on Endocrine Society guidelines, so 14 to 15 years old, is associated with better adult mental health, including decreased suicidal ideation compared to desiring and not accessing hormone therapy at that age. So the data are very clear. All this gets kind of intentionally dismissed or erased in a lot of these policy debates. And everything points in the same direction. When you practice clinically or doing research, there's a clear convergence of what needs to happen. It's more the enactment in policy that has been very challenging for all of us here, I think.
I have nothing to add with it relation to the data and the research because it's been so well discussed by everyone here. The one comment I have is just the way we talk about these things that youth are seeing. When we talk about it as the gender identity debate, the transgender issue, the LGBTQ plus issue, what we are telling youth is that they are a debate, that they are an issue, and that they are the problem. And that kind of messaging is so damaging. So where we can confront that messaging and say, it's not a matter of debating, person's right to access healthcare, a young person's ability to thrive in school. What we are talking about here are just the very basic notions of human rights and equity. And that should never, ever be a debate.
Yeah, and when talking about mental health, I just want to highlight that I think this is one of the places where misinformation, or whether it's malicious or not, is getting kind of pulled out of this information. So we know, like you've all mentioned, especially thanks to the work at the Trevor Project, that we know these mental health outcomes come with an LGBTQ identity. But I think right now, the misinformation campaign is that the health outcomes are a symptom of the actual identity status. And I want to be clear, that is not what it is. Those are not linked. It is society's response to those identities, which creates mental health challenges. It is not lumped together with that identity. And in fact, we may one day see a society that is much more inclusive and accepting, and hopefully those stats go all the way away. I think right now, what I'm seeing in K-12 parents, for instance, is that they're misusing this information, and they're basically saying, if we allow someone to have this identity, they're going to have mental health outcomes. And so that is a harmful thing we could be doing to young people. And that is the exact wrong interpretation of this type of data. So I want to make sure we highlight that when people are talking about it, to be clear that these mental health outcomes are because of the way that society is treating these young individuals, and not because the individuals come with mental health outcomes and an identity. I don't know if I articulated that well. Preston, you're probably much better talking about that. But.
No, you did, honestly. It is one of the very things we discussed, and you're absolutely correct. No matter, it's come up in so many policy debates, right? It's almost as if the assumption is that if this person were not LGBTQ, their mental health outcomes would suddenly be positive. And that's also not true, right? Because people don't live in a vacuum or in a silo, and we recognize that a society's response to our identities and sexuality more than the actual sexuality or identity itself. So thank you for making that point, Megan.
So with all of that in mind, and Megan, you sort of spoke about it in your initial remarks about folks that are multiply marginalized, folks that might be Black and trans or Black and queer. I sort of want to sort of lift up also what we're seeing in schools regarding race and how it intersects with what's going on with Don't Say Gay bills within,
the political context. And I'll actually ask Preston this question. Would you be able to speak to the impact that LGBTQ youth of color, the ways in which they're impacted by this political environment where they're both dealing with efforts to sanitize our nation's terrible racial history and also efforts to erase their identities, their gender identities, their sexual identities as well. And these two phenomena converging, what impacts does that have for LGBTQ youth of color?
Yeah, so due to a number of factors, right, we fully recognize that LGBTQ people of color, or really folks who are at the intersection of multiple marginalized identities, have a exacerbated attack on them, right, facing different social ills on many fronts. And the one thing that I oftentimes say is our opponents may not like intersectionality, but they sure do know how to attack issues intersectionally. And it is an unfortunate reality, right? And so where you see like LGBTQ people being impacted by policies and laws, you see people of color being impacted by policies and laws, you see immigrant folks, you see poorer people or people with low or no incomes, right? Like it is an intentional concerted effort that then turns into cheap political points and debates. And it's something that we've seen time and again. And so, I know intersectionality certainly has become a buzzword over the past couple of years, but it still has real world impacts for many of these communities. And again, it makes LGBTQ people of color in particular, through a lot of our data, and frankly, through my personal experience, a lot of mental health outcomes more pronounced, I should say. And so it's important to note that while we're discussing things like Florida's Don't Say Gay or Trans bill, they've also popped up in South Carolina, Arizona, Alabama, Ohio, Texas, Idaho, Montana, South Dakota, South Carolina, actually, too, right? So like, and these are not just me randomly naming 50 states, right? This is actually a moment where we've seen a couple of weeks ago, almost like the 16th or 17th anti-trans bill in some respect been signed by the governor, and only a couple of them have been vetoed. And so that's really important to make note, especially because within a lot of these bills, what's also attached to them are anti-critical race theory rhetoric, right? Or frankly, social emotional learning rhetoric or anti-social emotional learning rhetoric. And what that does is, right, it creates an environment where especially people with the intersection of those margins feel attacked on multiple sides. And all of it is done as an effort to silence conversation around marginalized people at school. White supremacy has always attacked many of these issues intersectionally. It is really done to erase our history out of textbooks and essentially hope that history, frankly, repeats itself in a number of ways for these communities. I'll just end on this note, right? Research show that youth with marginalized identities inherently, frankly, experience disproportionate rates of mental health challenges like bullying and suicide risk. But again, it's not because of who they are, right? To the point we're making earlier, but because of how they are mistreated by society. And so for us, and particularly as I serve as the Director of Advocacy and Government Affairs, at the Trevor Project, one of the things that I make clear with lawmakers is that you have to use your bully pulpit to actually advocate on behalf of communities who oftentimes do not have access to talk to you, right? Like you have to, in some ways, speak to people enough to be their voice, not to take over their voice. Everyone has a voice. No one is voiceless, right? But you need to use your pulpit in a way that actually empowers others and really empowers people across the aisle to do the right thing. Ultimately, like you're fully correct, right? There is this, we know that there's history that's attempted to sanitize white supremacy and institutional racism in K through 12 schools, but also beyond that. But the damages and the devastating effects that we're seeing are really, really terrible. And we'll see some impacts for quite a time, to be honest.
So, Sophie, we're an association, professional association of health educators from across the country. And many of our members would like to learn, different strategies on how to implement an inclusive LGBTQ curriculum, action plan, or program. I'm wondering if you could sort of speak to what are sort of best practices in implementing an inclusive framework for LGBTQ programming, whether it's, at a K through 12 school or at a health center. what are the foundational components of an inclusive LGBTQ curriculum? Because I think sometimes we take for granted that everyone sort of knows those aspects. And so if you could, each of you could sort of speak to those aspects, sort of tangible things that our members can sort of apply in their work.
Yeah, one thing that I just want to like start out with is get started. I hear so many folks who say, I don't want to get it wrong. I know I'm going to get it wrong. I'm going to define this term wrong. I'm going to use, the wrong XYZ. And it makes people feel like they can't actually get the work started. And so nothing happens. And so I think that just to start off with, do the research, find allies, find organizations that you can reach out to for materials, but do get something started sooner rather than later, and don't let a fear of making a mistake impede you from doing the right thing.
Yeah, and I think, sorry. The important thing is that there are curricula that exist already, so you do not have to invent it yourself. If you're feeling a little nervous, you can look to California, Colorado, Connecticut, Illinois, New Jersey, Nevada, and Oregon, because they have well through the process, curricula that you can use at a K-12 level that I'm sure would be great at an undergrad level too, for where we're at right now. And so I would say, yeah, the curriculum has been made. So if you do that, and then I'd also just highlight, I think it was Alex who said this, I'm not quite sure, sorry, that just having supportive educators on campus. So even if you are not in a position where you can teach a full sex ed class in your class because you teach history, I think there are still ways to build inclusive curricula in there, but if you're not feeling like you can teach the sex ed part, you can still be a supportive adult. You can make sure that it's an overt presence in your school by signaling to folks that you are a safe person for those.
I think it's also important to try to do this in partnership with your local LGBTQI+ community in terms of even taking existing curriculum. We have a lot on our website for healthcare providers, but there's an opportunity to tailor it for the particular needs and culture that you serve. It's a vast, diverse country that we live in. So part of what we recommend is doing, and this obviously takes a fair bit of time and commitment, but community needs assessment, whether that's through surveys or focus groups or both. Organizational readiness assessment is something that we often do to understand knowledge, attitudes, beliefs, practices, and policies within an organization to see what the strengths are that you can leverage and what opportunities for improvement are, and to identify what the competencies are that you want people to have at the end of the process. There's a lot that needs to be learned, not just in terms of content for educators to deliver, but in terms of how to deal with microaggressions that come up in the classroom, for example, or how to learn from students in the class who have LGBTQI+ identities or intersecting identities without burdening them unduly with the emotional labor of teaching people about who they are, unless that's something they really want to do and are motivated to do themselves. How to design case scenarios that are reflective of the nuance and complexity of LGBTQI+ communities without stereotyping or causing offense. So there are a lot of components to this that aren't, on the one hand, this is easy and there are existing curricula that don't require us to reinvent the wheel. On the other hand, the implementation can be a little fraught if people don't work through their own implicit bias. We see that often. I think people want to kind of just go with it without doing some of the hard internal work. And that comes up very quickly and easily if students scratch beneath the surface a bit, ask questions that probe beyond a more superficial presentation. And it's going to come out in an instructor's nonverbal communication as well, body language, facial expressions, that kind of thing. So we have learned that a big and critical early part of this is creating a safe space for people to work through their own implicit bias. So it comes out with colleagues and not with students or with patients, for example.
Yeah, and for us, we start there, right? Like we start right at the point that Alex ended on, which was do your homework. right? Like that is the first thing, right? Like now, of course, I know there was the era of like Google, right? Like I'm gonna just Google it, right? I'm not gonna teach, just Google it. And I think that's a fair answer in many respects, depending on who you're asking, right? The people who are most impacted should not be the folks who are doing educating you all the time on their experiences and their identities. But I do think it's an important part to take the time to just learn what is or is not being offered in your community. And so, is health education offered at all? Is it LGBT inclusive? Who are the decision makers, right? Like, what are you attempting to actually change in your community? So I think that's really important to just do your homework and realize that there's no wrong answer for what you realize your objective is, right? Sometimes your homework really is just getting to learn more about people. Sometimes your homework is actually creating a new law, right? And I don't think one necessarily is more important than the other, so long as you're attempting to shift the narrative of what's fundamentally happening in your community. I think next, again, to that point, you should consider how you want to get involved, right? Should you attend your local school board meetings, ask questions? Do you want to contact the local LGBTQ organization and join their efforts, right? If you're not sure how to get started, right, just look to the local LGBTQ organization, as some of the co-panelists are already saying, right? The communities are out there, the people are out there, in many places, right? We don't want to pretend that that's true in every place. And then, of course, right, I'm always going to lift up the efforts of the Trevor Project. And so, you can always email ways to get involved with the Trevor Project advocacy team by emailing advocacy@thetrevorproject.org. We'll certainly help you figure out like who are the places, who are the players, and how you can get involved. But those are just a few tips, but I do think the answer many times is to act. I so agree with Mason that so often I hear people who are so afraid to make a mistake that they just do nothing, right? And certainly that can't be the response either. So we have to figure out how we make these spaces safe and affirmed, and how are you holding yourself accountable, right? Because I think the fear about making a mistake is not the mistake itself, it's how is someone gonna hold me accountable when and if I do make that mistake? And we have to just be willing to be held accountable, right, when we do make these mistakes. So that's just a little bit about like what strategies can be employed for people who really want to be involved.
Yeah,
To the point about mistakes, real quick, is always approaching the conversation with cultural humility, and know that it's not if I make a mistake, it's a matter of when. We're all going to make mistakes, and that's okay, as long as Preston says, you're holding yourself accountable. You're using that as an opportunity for you to learn, you to reflect, and build power from those mistakes, knowing that you're holding yourself accountable to the work that you're doing and the communities that you're serving.
Right. So basically, each of you are sort of speaking to different dynamics of both doing the internal work that's necessary to unlearn and learn, and having that propel one to act, whether it's in a classroom setting or at a health center. And Preston, you sort of spoke to advocacy and how to get engaged externally as it relates to LGBTQ advocacy. Here at Sophie, we're really big on advocacy, as Dr. Megan Smith knows, and we're really trying to engage our members around advocacy, and particularly with our upcoming summit on youth health equity. One of the things that I think it's important to sort of learn more about too, that you sort of started to speak about, Preston, is what are the ways that people can get involved, from an advocacy standpoint, from a political standpoint, outside of classroom settings, and also what are the ways in which we can sort of convert allyship into what I am reading more about, and people sort of invoking this term of being an accomplice as it relates to LGBTQ justice and racial justice. So if you can sort of speak to what are the ways in which our classroom advocacy can transform into advocacy within our communities, really speaking up and speaking out against what we're seeing at local school boards, at state legislatures. So I know, Preston, you sort of already spoke a little bit to that, but I want to sort of open it up to some of the others too, or even to you again, about what are the ways in which we can really focus on that societal sort of mobilization that's needed.
Well, I think it's been said, but I just want to highlight it, that you should not start your own group yet. You should look for groups that exist and are already doing this work in your community at whatever level you would like, either at your city, county, state, national. I think it's so exciting when we have new interest and new effort, and sometimes that has looked like a new group forming and then it gets a little confusing. So I would first look to other folks to see if there are other advocates already in your area doing that work. And then I'll let others speak so I don't dominate the time.
Well, I do, thank you. And I do want to start someplace that's oftentimes uncomfortable for people, which is that there are so many performative allies. And I think over the years, when I've just seen a lot of performance behind allyship, I think a fun, and by fun, I don't mean exciting, but a fun fact is that, you know, when I was listening to a podcast late last year for NPR Code Switch, the title was The Racial Reckoning That Wasn't. And so I started to like, oh, what is this about? Like, okay, like I see the title, it's pretty in your face, so let me just listen to it. And in the title, it was just, or in the podcast episode itself, they were discussing how support for Black Lives Matter in 2020 and 2021, near the end of 2021, actually was at the lowest it was since it originally was founded back in 2013. And it made me think, right? Because this was the time of like all of the summer of protest, right? This was the time where everyone, it seemed like everyone, right, who also, they risked their lives to maybe experience police violence while risking their lives experiencing COVID, right? To actually push back against police violence and victimization and criminalization. Then months later, it became the lowest that it's ever been in terms of support. And it makes me reflect on just why and what does that look like? And it's because, right, a lot of it was really corporate driven or became corporate driven, or at least, you know, corporatized or sponsored in some respects. And there wasn't like a sustainable relationship that was actually built with organizers and Black communities writ large. It was really transactional, and it just felt like the thing to do. And so I push back against allyship at this moment because I do want people to lean into what we consider co-conspiratorship or accomplishship. And there is a difference in what that actually looks like. And so, and this has shifted for me over the years, right? And I don't want to pretend that allyship is bad, right? Like inherently allyship is not bad in and of itself, right? It is about immersing yourself in the community, persons or groups, right, with which you want to advocate and with whom you want to be aligned with. It is asking how you can help. It is figuring out how do you shift some of the burden on the communities impacted to the people who are not impacted, at least on a particular scale. But the unfortunate reality also is that many people treat allyship as the end when it is the start. And so when you believe and when you think through like the aim of allyship and then start to think about co-conspiratorship, right, it's not easy, right? It's not easy to actually give up or relinquish your power for the benefit of others. And I think a prime example of this happens oftentimes on panels when people are paid to speak on issue areas, right? There are many people who receive funds to speak on panels, which, you know, many of us do, right? But I think the question is, what is the topic you're speaking about as an example, right? And is someone actually more better experienced or have the lived experience to actually sit on this panel and receive the funds, right? Because that is about relinquishing your power for the benefit of someone else. That is accompliceship. Allyship is actually being on the panel, taking the funds while speaking on behalf of the communities that you're not a part of, right? And so I want to start there always because it's always an awkward moment when people, what do you mean you don't want me to be an ally? I'm like, that's not what I'm saying. What I'm saying is I don't want you to end at allyship, right? And that is when it becomes really complicated. All of that to say, right, there are different ways that folks can get involved and support the work, but I really do believe the first type of work is your own self-reflection of actually, where do you want to be? How do you want to navigate? Who are the communities that you're advocating with and whom? And really, what are you doing this all for, right? And a lot of that really goes back to Megan's original point is, it does not have to start with you, right? Unless you do live in that community that there's nothing, right? And I want to, again, I worked in the South and the Midwest for a while. So there are some places that things do not exist and you do have to kind of be that person to start it. But in many places, that's not the case. And so just don't believe, right, that this movement is your ego, right? And then lean into your own discomfort sometimes and asking for support.
Yeah, I think the point of you might be the only person in like I've lived in rural communities for a good portion of my life. And sure, in that county, there may not be much happening, but there may be a state equality organization that you can look to and say, hey, I live in this district. You know, do a little bit of research about your legislators who are representing you and where are they on some of these issues that are happening in your state. That can be a really great starting point for reaching out to an organization that's maybe doing some advocacy to say, I know my legislator isn't supportive. I know my legislator is supportive. And start there with educating yourself a little bit about the climate that you're living in. But certainly approaching state organizations or other organizations doing this work with that cultural humility to say, I don't know everything. I don't have all the answers, but I want to do more. Where can you put me to work? To Preston's point also about performative allyship, I know a lot of conversations do start around pronouns and where people, you know, I'm going to put my pronoun in my email signature. I'm going to articulate my pronoun. And that's a really good place to start. But if that is where you are ending your allyship, you're not hearing the pronouns of others, and you're not taking that to a step that means a reflection of equality and equity for folks who use pronouns that are different from your own, or who, you know, just want to be seen and want to be heard beyond a matter of a few letters. And so I think it's always a question of, I've learned about this, I've implemented this in my life, what's next? And allyship, moving to accomplishment, should be a matter of what's next, what's next, what's next, and know that approach it with excitement. Like there's always more to learn. There's always more ways that we can be having an impact on people around us. And I know sometimes when we do this kind of workshop and this work, people say, I feel overwhelmed. I feel overwhelmed by the amount of information, by the new terms, new to me terms, not new in general concepts and terms. I feel overwhelmed. And to try and, when you feel that, turn it around a little bit, say, no, this can be really exciting. This can be opportunity. This can be growth. This can be power for movements that are in so much need of power and support.
And if it does feel daunting, because I live in a place where it is a daunting task, I think you can start small. I think I love what you said, Preston, and I'm kind of thinking, I'm a developmental scientist, so now it's on a developmental spectrum. But I'm thinking, you know, we are not mad at allies. Allies are just at the beginning of their development. So I love that you mentioned that people can sort of increase their influence, increase their action, etc. And I think, you know, it can start as small as you, like we've said, educating yourself, and then having conversations with people that you love and trust and care about the things you're learning, because then you can kind of start it in their brains, and that can be a really safe place to start practicing your voice in these areas, and then move up to people that might be in less known to you, right? Then you can talk to the school board, then you can talk to the city legislators or the council members. And so I think, you know, to say you have to start at the aggressive side is not true. You have to start where you're ready to start, and then remember, like Preston said, develop through it, keep going. So have those first initial talks, notice it's not as scary as you may have thought, and then move on to the next groups of people that you can talk to.
So with all of that in mind, the last question that I'll pose to each of you, 10 years from now, it'll be April 21st, 2032. And if you could speak to, what is the world that you want us to live in as it relates to LGBTQ health education? Where should the world be on April the 21st, 2032, as it relates to LGBTQ health education in our country? What would that ideal world look like? We'll end on a hopeful note.
We will definitely be saying gay. Sorry, that's just my sense of humor. You go for it.
No, but we will. So I'll say that, you know, I really want us to a world that leans into justice and equity and liberation and not just equality, right? Like I really envision a world that pushes for destigmatization and not criminalization and punishment as a first response. I really envision a world that we'll have an honest conversation around how laws and policies impact someone's entire body, right, from the top of their head to the sole of their feet. And we do have a long road ahead, but I'm really hopeful for a day where all young people feel safe and affirmed at school and at home, and feel represented in their education. Because truly only then will we be able to empower young people with the tools and knowledge necessary to lead and to live long, healthy, and happy lives. So that's really what I envision for the world.
Yeah, I think there's a beauty in telling the transformational narrative, right? The narrative of what it looks like when we get it right 10 years down the road. And I just want to highlight that when we get it right, it's not just good for LGBTQ youth. It's not just good for youth of color. It's good for everybody. When everyone can feel comfortable in their identity and we don't feel like we have to throw hate around, it actually benefits all people in society, and we come together a little bit closer. And so I hope that in 10 years, we're seeing these sort of walls of hate that have come up in response to our progress forward kind of dissipate into further progress forward, and that we notice that it's better for everyone, that it's better for youth of all identities.
I think making this very tactile in a way, I want textbooks across all age, all educational levels to not have, here's the section on LGBTQ plus history, and here's the section on LGBTQ plus health, but that it is integrated into all of the subjects that we are studying, so that we have a conversation about people, about facts, about science that is inclusive, not a footnote, not an endnote, not a special section, but just a part of what we learn, everything from the ABCs up through educating our doctors, nurses, lawyers, and higher degrees. It's just a part of the curriculum.
Yeah, I hope in 2032, my neighborhood's not underwater. That's one thing to strive for. Separate from that, as far as LGBTQI plus health education goes, as people are saying, it's important to normalize diversity in terms of sexual orientation, gender identity, and sex development, that these are concepts that apply to all people. They apply to straight people, cisgender people, endosex people. Everyone has a sexual orientation, everyone has a gender identity, everyone has sex development of some kind, or everyone has more than one of these things. And that it's part of the standard curriculum, not something that's considered subspecialty training for healthcare professionals, for example, right? So it's not like some people are trained in it and other people aren't. Every medical student graduating, every social work student graduating, every nursing student graduating has this in their repertoire and is fully equipped and prepared, because we end up with barriers to access when you have to find the one person in your state who is comfortable and competent working with LGBTQI plus communities, for example. So standardization, normalization, scale up, and that I think contributes to further destigmatization as well. Part of the reason that a lot of this legislation happens and people get away with it is because there's such a low knowledge fund. And if everybody knew more, they wouldn't be manipulated by the baloney that we hear. So hopefully we'll get to that point as well, where more knowledge shifts policy debates.
I'd like to, if I can, just add a positive anecdote that our young people are leading the charge on this. I think they're kind of pushing us forward in a way that I appreciate very greatly. I've been teaching at the middle school level since, mid 2000s, like 2010. And just the change in the gender and sexual identification of self and how safe it feels to young people publicly at the middle school level has changed in, again, anecdotally, my experience. So I have lots of young people who feel very safe to identify themselves sexually. And then recently, I'll just tell you this story, a young woman in class, for whatever reason, they were like, well, are you gay? And she thought about it very kind of pensively and then said, I'm not sure yet. And everyone was like, all right. And I just love that, because that's where we need to be, where it's like, yeah, that's a part of you. It's not all of you, and we don't need to judge you for that. And so I love that moment, because it's already happening right now in our young people. And we can keep that going if we help support them.
Well, on that note, and to that point, Megan, supporting our young people, that's the work that all of you are engaged in, whether it's your research or your advocacy work. I just want to thank all of you for these just wonderful insights that you've shared with us and our members today. Dr. Alex Karoglian, Mason Dunn, Dr. Megan Smith, and Preston Mitchum. Just thank you all. And with that note, there are a couple of things that we're going to share with our members as we're closing. We value your feedback on our Sophie webinars. And so we ask that you would complete the feedback survey that is found in the webinar drop-down menu. It could also be found on Sophie's eLearn at CORE, the Center for Online Resources and Education. And while you're browsing our core catalog or content library, you can also check out these 5 journal self-studies that were published last year. And to Dr. Megan Smith's point regarding supporting our young people, our 2022 Advocacy Summit is focusing on youth health equity, and we'll focus on all of the topics that we've discussed today: LGBTQ health, anti-racism in health, misinformation, mental health. And so we're really looking forward to this summit, and we hope that you'll join us for actually our first in-person summit this year in a couple of years. And so our summit's going to be held here in Washington, D.C. At the Capitol Hill Hilton, and there will be more information to come. Just stay tuned for our website, or on our website and our social media, for additional details regarding the summit. So on behalf of Sophie, I want to thank our presenters again, just for their wonderful insights that they've shared with us, and all of the work that they're doing in their respective roles in community as well, to really lift up our LGBTQ youth. We can't thank them enough for the work that they're doing. So thank you very much. And this concludes our webinar for today. Take care.